probably of the three most frequent calls I get, one of them is about sudden illness of an industry member.
But my four guiding principles when either getting a serious diagnosis or finding yourself suddenly hospitalized are get smart fast, get organized, stand your ground but nicely, and always follow up.
Every single detail matters, and taking lots of notes and digging, as Elizabeth said, and understanding that you really have to learn some new concepts that you have never been exposed to before. And it's okay to ask questions. Keep asking questions. But if you find yourself in the hospital, I think it's very important, number one, to always have someone with you. And I think it's also important to let that person be your care partner. Patients forget up to 80% of what they've been told. It's very stressful, but yet doctors honor their relationships with their patients by speaking to them. I mean, they're adults to adults, but they need that extra set of eyes, ears, and hands to help make up for the fact that the patient isn't going to be 100%, obviously. So the care partner really needs to be fully engaged as well. And it's important to understand too that when you go into the hospital that there are certain hospital acquired conditions. That's sort of the verbiage, but things happen to people in the hospitals just because they're in the hospital. 1 out of 3 patients will be harmed by a hospital acquired condition. And a lot of it is nurses are stretched to the max. You know, we have sicker patients than we've ever had before. They are pulled in a million directions, and so are doctors.
You want to be the best person you can be, or your advocate to be the best person they can be to help you get your care. So what that means is you want to understand what happened to you, or your person needs to know what happened, what led up to whatever the accident was. Also to know your past medical history. You need to own it. You need to not just say, oh, well, my doctor knows this or that. No, you need to know you have high cholesterol, you have diabetes, you have hypertension. You have to know what procedures you've had done, because people will need that information to take care of you. Knowing what surgeries you've had in the past. Knowing what's happened when you've had anesthesia. Have you had any problems with any medications? Do you have any drug allergies? These are really important things that if you don't know the answers and you're in a new place with new doctors, no one else is going to know that information. Take a Word document, write the meds. First, I would start with allergies. That's really important. List your meds, the dosage, and the frequency. Okay, everything's important. Aspirin, baby aspirin, Advil, Aleve, those are all really important things. And then I also would suggest that you make a past medical history, just a snapshot of your 10 most important conditions.
What I mean by stand your ground nicely is make friends with everyone whose help you will need, whether it's the person who answers the phone, the one who does the scheduling, the aides, the nurses in the hospital, and come prepared to your doctor visits. I would echo what Karen said, bring a note taker. You really need someone with you to help absorb the information, take the notes, ask the questions. Bring your questions to the doctor. Be mindful of the time, of their time, but don't leave until you get all your questions answered. Don't be afraid to ask for second opinions or third opinions on your diagnosis. This goes to what you said, you get conflicting advice.
Yes, you're in the hospital? Definitely. Make friends with everybody. Love your nurses. Bring every shift, donuts, cakes, candy, coffee.
Look after their health.
Look after their health. Seriously, vegan options are great. But the fact is, those nurses that are taking care, that are helping your whoever, oh my God, it's unbelievable what they're doing.
And the studies have been borne out over and over again that about half of all doctors do not wash their hands, despite the fact that it is the #1 way to help prevent infections.
If you've got a child over the age of 21 who's away at school or living in a different city, it would behoove you to get a healthcare directive for that child, because it's something that we don't think about, but God forbid the child winds up in an emergency room and you hear about it, you call, and you get a response. I'm sorry, but we don't know who you are, you're calling on the phone, you're saying you're the parent, we're not sure, and we can't, release information to you.